A clinical study published in the Journal of Dental Research provides important new insights into periodontitis and tooth loss, leading to fundamental improvements in preventive care. By stratifying patients based on known periodontal disease risk factors, including genetics, dental clinicians can now provide more personalized preventive care.
The move towards personalized medicines has already taken place in clinical practice, particularly in medical oncology, where there are very good examples now of gene tests that will predict the risk in a healthy person, and also of gene tests that will predict a response to a particular treatment once a cancer has developed. So that approach is now being extended into other areas of medicine, including into the areas of the common multifactorial diseases, such as periodontal disease.
We typically look at patients and their disease status. Are they healthy or not? For the first time in dentistry, the University of Michigan study gives us a glimpse of a healthy patient and what their prognosis is for acquiring the disease later in life.
Periodontal disease is caused by inflammation triggered by bacteria in the mouth. Inflammation is caused by proteins that your body makes. Interleukin-1, or the family of interleukin-1 proteins, are very central to this. So if you have a particular genotype for interleukin-1, you are more likely to make more interleukin-1 when your cells are stimulated by the bacteria that cause periodontal disease. And as a result of that, having that genotype gives you a lifelong higher risk of developing periodontal disease.
We think that this represents a real opportunity to use genetics and for dentists to be part of the future of healthcare and medicine by applying personalized medicine to prevention.
The takeaway message from the Michigan study for dentists is that, as well as the conventional risk factors for periodontal disease, such as smoking and diabetes, we can now add in the interleukin-1 genotype and take it into account when thinking about preventive measures for our patients.
This would be an enormous value in dentistry, because now we'll be able to identify a segment of the population who, depending on the risk factors which they demonstrate, will be able to avail themselves to preventive care on a regular basis. And I foresee in medicine and dentistry that as part of standard risk assessment protocol, as part of your standard examination, either in medicine or in dentistry, you'll also have a risk assessment so that you'll be able to avail yourself to minimally invasive treatments at a very early stage, and indeed have greater outcomes as a result.
I think dentistry could really be one of the first areas of public health that could adopt and do well from the use of genetics. Dentistry has a long history of leading the way in public health. This is yet another way in which it could show that leadership.